Thank you, and good afternoon, Governor. Good afternoon, Lieutenant Governor, Dr. Scrace, and everyone watching. I'm going to talk a little bit about rapid response. Here are our numbers. I should just explain first that the New Mexico Environment Department, while you may have come to know us again for air, water, waste protections, many of you now know us as the OSHA program for the state of New Mexico, where we work with employers and make sure that they are keeping their employees safe. And in that vein, we also are working extensively on the rapid responses, making sure that COVID is not in the workplace, as that is an occupational hazard. As we do that, we track rapid responses. That's where we go out to businesses and ensure that COVID is not spreading in the workplace. These rapid responses, as you can see, over the past 6 weeks have significantly increased. We are now 832 rapid responses for the period of October 12th through 18th. And we've managed, as a state, over 4,800 rapid responses since we started tracking in May. This sheer volume is confirming what Dr. Scrace talked about, is that the numbers are indicating that COVID is definitely traveling through communities as well as workplaces. Nora, we can go to the next slide. So what are we doing about it? What's changing? And here's how I would explain what we're doing. And this slide, while a little bit busy, I think depicts exactly what is happening as we move forward. Starting today, the New Mexico Environment Department is publishing a rapid response COVID-19 watch list. Once a business goes through a rapid response, as they get to their second rapid response, they will appear on this watch list. The watch list is designed to make information more transparent, more easy to access, to get it into communities. And to that end, we are going to be publishing this list, sending it out to the media, tweeting about it, placing it on social media, trying to let communities know which businesses have high numbers of rapid responses. So while the goal here is to stay home, if you need to go out to one of these businesses, you will have the tools in an easy to find way as to where COVID is in the workplace in your community. So that's the first thing we're doing. The second thing we're doing is, after you pass your second rapid response in the period of 14 days, you may get to a third or a fourth. When you hit that number of 4 rapid responses within 14 days, certain businesses will now have to cease operations and shut down for a period of 2 weeks. These are largely the businesses like restaurants and salons and gyms and places like that, lodging, etc. Non-essential businesses, if you will have to shut down for that period of time to stop the spread of COVID within the workforce. And again, the goal here is exactly that, to stop the spread of COVID. And to recognize that while many businesses are doing their due diligence in implementing CSP's COVID safe practices on a daily basis, there is that occasion where a business will experience a rapid response. If you're not experiencing those in a frequent way in that period of 14 days, you then have the ability to stay open and continue to serve the public. For those that are having more struggle with this concept and get to that 4 in 14 days, that's where the period of shutdown begins. Governor, I will pass this back over to you, and thank you.
Governor, you're still muted. I'm so sorry.
We're all having technical difficulties. Thank you, Nora, for reminding me. My apologies, everyone. So I'm going to go over then the operationalizing of our new measures and our effort to crack down on this virus. And I really want to make sure that that's the language that we're using, that we're not shutting down, because we're trying to learn to live with the virus during what's coming, which is even tougher winter months. So we're having a tough fall by all likelihood, and all of the advice and information we're getting from national experts on our own modeling team, that the winter could pose even more challenges to New Mexico. And I want to frame it with three quick more things, and then let's talk about what changes. One, New Mexico has a third less hospital and healthcare capacity per capita than any other state in the country. That means we have to get it right. And we have to do everything we can to make sure people can get routine care, that mamas can deliver their babies safely in the hospital when they're going to the hospital to deliver those babies, that if, God forbid, we have a trauma or an accident or someone injured in a fire, that we have the healthcare system that's ready and available to do that. And it gets really stretched when you have any kind of an issue, whether that's a flu epidemic or a significant flu season, but with a pandemic and a deadly virus, that becomes moment to moment if we can't stabilize transmission. Two, the number of cases, as you saw, is exponential. There were some days over the last several where our positivity rate was 8 and a little above. What does that mean? That means that far too many people that we're testing are showing that they have the virus. That, along with the rate of infection, are two ways that we track how prevalent this virus is. It's prevalent in the state. And third, we want to make sure that as we're protecting our healthcare resources and we're protecting New Mexicans, right, that we're saving lives in that design, while also recognizing that we're trying to, right, have some sense of normalcy in the state of New Mexico. All right, so effective Friday, the 23rd, that's this Friday, what Secretary Kenny was saying, if a business records 4 rapid responses in a 14-day period, that business must close for 2 full weeks so that we can reset, right, basically where we are, where we've got a particular outbreak. This applies to food and drink establishments, retail establishments, places of lodging, and any close contact businesses as defined in the public health order. Secretary Kenny said that already. Gyms and salons are other examples. It's basically everyone, all right? This is how we can crack down on where the virus is spreading. Businesses are not spreading the virus. People coming to businesses are spreading the virus and giving it to employees at that business. So this is a way for us to minimize that spread and deal with outbreaks. We want to do that so that we don't have wholesale economic disruption. And we believe this one effort is significant enough that we will be focusing on locations and high-risk communities so that we can get folks back to the whole state managing the virus and limiting the spread. All right, next slide. All right, now we're going to also require additional very strict safety measures for indoor dining. And I know that this is an area that we all struggle with because we want our restaurants to succeed. It is already incredibly hard. Winter is coming, and 25% occupancy or limited occupancy in indoors is not a sustainable model economically. We also want people to be safe. You can't wear a mask while you eat, and you're indoors, which means the virus stays in that indoor setting. So we really have to find better ways to do this more effectively. We think this strategy, which got great input, and I want to say thank you, from the Restaurant Association, by other businesses and restaurants, and by the Economic Recovery Council, that if food and drink establishments work to do New Mexico Safe certification, which is a free certification, but goes through what's required, the training, how to protect your employees, how to keep it as sanitized as possible, and how to deal with the flow of traffic so that you're minimizing spread. We're going to ask everyone to do that. If you don't do that, you can't keep doing any indoor dining. Let me say that again. For food and drink establishments, restaurants, breweries, If you don't complete the New Mexico Safe Certification Training Program, which is free and it's online and it's quick, you cannot continue to offer indoor dining at 25%. You must also consent to spot testing of employees. What that means is state health officials will target businesses for testing in our high-risk counties where the health data shows that the spread is the worst. We also want food and drink establishments to keep a logbook of customers who dine on site for 3 weeks to support contact tracing. Food and drink establishments will have until the end of the month, almost October 30th, to become certified. Those that are not certified after that date would not be able to offer indoor dining. Food and drink establishments remain a top source, as I talked about, of possible exposure, according to state contact tracers. And we have to find a way to safely operate indoor dining and lower the spread and rate of infection, because again, winter is coming. And if we don't figure it out, there will never be an opportunity to increase indoor dining. And we know that we need to find a way to do that. We think these structures and these strict COVID safe practices are the prudent way forward. And I want to say one more thing about this slide. The state provides the support at no cost to the business. The state shows up to provide the testing where appropriate in high-risk areas at no cost to the business. We want to make sure that you are safely operating, that you have access to the resources of the state so that you can stay open. That is the goal here, and showing that these standards work well enough that we can make, I hope, more positive arrangements moving forward. Okay, next slide. These are additional measures that we think will slow the spread while keeping the economy viable. So also effective Friday, October 23rd, all retail spaces must close by 10 p.m. every night. Remember, we're trying to limit where people are going. Now, I want to make clear that this is excluded. Retail is not pharmacy, right? So anybody who needs those services, no matter what time it is, those are still available. So this is basic retail shopping, healthcare, and necessary supplies would be exempt from the standard. And it's really intended to minimize what's happening and where people are going. So if you were at a food establishment, you chose that instead of retail shopping at a potential largely 24-hour big box store. Now, I said it ahead of the slide. This aligns with our 10 p.m. closing time for food and drink. So we're trying to minimize where people are going. We're trying to make sure that these are applied fairly. And we think this also is an effective measure. We're also asking New Mexicans, please try and shop alone. Do not bring your family. Consider ordering online. Do curbside pickup and delivery. We're working with retailers and grocery stores and big box stores to help make this easier and to even think about having hours that are specific to single heads of households, so single parents who don't have any other options here, and for seniors, again, to really minimize risk, to maximize controlling the rate of spread of the virus. Effective Friday, October 23rd, state-operated museums and historical sites are going to close. Now, that's something that we can do that, again, keeps us in that triangle. And we are optimistic. I really want people to hear that. We are in a very difficult place currently in the state of New Mexico. The virus is winning. We have the opportunity. It's the fourth quarter. The virus doesn't have to win. We can win. We can manage it. We can come back down to a 2% positivity rate. And I'm optimistic that these efforts, working in partnership with our businesses, that we can make these differences as long as New Mexicans support these by wearing your masks, keeping socially distanced, and staying home. So I want to talk about our triangle for success, which I believe is my next slide. we really believe, because right, duration and mobility and indoors, outdoors, whether you wear a mask and all those things that we used to talk about in that Johns Hopkins model, really, if we figure out a way, so notice that these are masks, safely wearing your masks, that if we can minimize without creating harm to ourselves or our families, by making sure that we're getting necessary medical care, that where we're required to do in-person work, of course we do that, that where you need self-care to run an errand, where you need childcare assistance, that we of course need to go to those places. But if we can try to make this triangle work, don't go more than 3 places a day. And if you have the ability to go nowhere several days in a row without those hardships or issues or precautions that I mentioned about keeping your family safe, and the virus can't use you as a vehicle to move around. And we don't have much time. If we don't attack and snuff out the virus right now by working collectively with businesses and each other, then the virus will win, and it leaves us very little opportunity to save lives and to keep our healthcare system from being overrun. And that other tool causes widespread economic disruption. Our North Star is still saving lives and making sure that our healthcare system isn't overrun. But we still believe in the modeling team and using science mitigation measures that we can win, we can manage the virus. So I really need folks to help us. Last couple of things. It really is spreading exponentially. Please remember what Dr. Scrace said. New Mexico went from one of the best states in the nation to one of the states that's in the most trouble in the nation. And it's really because we let our guard down, because it is a vicious, invisible enemy. It is an exhausting process with very little tools except modifying our behavior to attack. But attack it we must.